Hello, everybody. I am Ayan Mahmood, and I'm a project support officer with the Boulder Healthier Champions team. Today, I will be talking to you about physical activity and behaviour change webinar. So, what is physical activity? Physical activity is all movement, including during leisure time, for sport, for transport to get to and from places, and as part of a person's work. Some of the questions that could be posed to participants thinking about their own physical activity includes what type of movement do you partake in daily? How much do you know about how much do you know how much physical activity is necessary? Do you have a regular mode of transport, and do you have a favorite type of physical activity? So, what are the benefits of physical activity? The UK Chief Medical Officer in 2019 said uh, if physical activity were a drug, we would refer to it as a miracle cure due to the great many illnesses it can prevent and help treat, such as it can reduce dementia, it can reduce cardiovascular disease by up to 30%, type 2 diabetes by up to 40%, colon cancers, depression, and that type of thing. The wider health benefits include having a viable working population for employment, increased academic attainment, reduced burden on social welfare, reduced social isolation, reduced traffic congestions, and among other things, improved air quality. So, why does physical activity matter? Physical inactivity is one of the top three drivers of premature mortality. It costs the UK 7.4 billion annually, 900 million to the NHS alone. Being active every day can reduce the risk of 40 different diseases, and being active daily can improve clinical outcomes and reduce symptoms for those living with disease at every age. What are the guidelines? So, physical activity guidelines are set out by the UK Chief Medical Officer's report on the government website. So, there are three different sets of reports. So, physical activity for early years, those that are 1 to 5 years old, which are encouraged to do up to 180 minutes of exercise per day. There's physical activity for children 5 to 18 years old, and they are encouraged to do up to 60 minutes of physical activity on a daily basis. And there's physical activity for adults and older adults, 150 minutes per week, or 75 minutes of vigorous activity per week. So there are different intensity levels in physical activity. The first one is moderate. Moderate level of activity noticeably increases your heart rate and breathing rate. You may sweat, but you're still able to carry on a conversation. You can talk, but you can't sing, and you feel like you're exercising, but you're not huffing and you're not puffing. The NHS physical activity guidelines for adults suggest aim to be physically active every day, even if it's just light activity. Do at least 150 minutes of moderate intensity exercise per week and reduce the time spent lying down. There is the vigorous intensity, which is activity done with a large amount of effort, resulting in a higher heart rate and quick breathing. It is difficult to make full sentences. Activities such as running, cycling, and tennis are usually classified as vigorous. So the NHS physical activity guidelines, as before, aim to be physically active every day, even if it's just light activity. Do at least 75 minutes of vigorous intensity exercise per week, and reduce time spent sitting or lying down. And the third intensity level is strengthening and balancing. Strength training is a key component for overall health and fitness for everyone. It is recommended that strength and conditioning training should be done to the point where you need short rests between repeating activities. For example, this includes Pilates, yoga, weightlifting, gardening, and carrying heavy shopping. The NHS physical activity guidelines for adults suggest to aim to be physically active every day, even if it's light activity. Do activities that improve health, balance, flexibility on at least 2 separate days in a week, and reduce time sitting or lying down. So here is a representation of the percentage of activity levels in Birmingham. So in dark blue, we have those who are inactive that do less than 30 minutes of exercise a week. In pink, we have those that are fairly active that do 30 to 149 minutes a week. And those that are active in light blue that do up to 150 minutes a week of exercise. So activities that help improve aerobic capacity, balance, and bone health include running, resistance training, aerobic circuit training, ball games, racket sports, yoga, tai chi, dance, walking, Nordic walking, and also cycling. So how active is Birmingham? So 55% of adults in Birmingham are active that do at least 30 minutes of exercise a day. And then there are 42% of children and young people in Birmingham that are active that do up to 60 minutes of exercise a day. What are the inequalities within Birmingham? So there are underrepresented groups. Inequalities in physical activity exist across a number of underrepresented groups. For example, those with disabilities and long-term health conditions, and those from certain ethnicities. Deprivation and physical inactivity is strongly linked to so physical inactivity is strongly linked to deprivation. Age, you are more likely to be inactive if you are a younger or an older person living within the city. And gender, women and girls are more likely to be inactive. So there are barriers that people face when they want to be more physically active. I'm going to discuss what the barriers are and ways to overcome them. So lack of time. Identify suitable time slots for physical activity. Make it part of your daily routine. Select activities such as walking, jogging, or cycling. The stairs. Start with 5 minutes and build up. Walk to meetings and stretch in between meetings as well. So the social support, share interest in physical activity with family and friends, ask for support, and perhaps get them to join different classes with you. Lack of energy, schedule physical activity when you feel more energetic during the day, convince yourself and give it a chance. Physical activity will increase your energy level and try it. Lack of motivation, so plan ahead, put it into your calendar, invite family and friends to exercise with you or join an exercise group. If you have a fear of injury, warm up and cool down to prevent injury. Exercise appropriately for age, fitness level, and health status, and choose an activity. Choose activities that you can do slowly, safely, and increase the amount you do as you grow confidence. And a lack of skills. Select activities that won't require climbing stairs or jogging, or taking a class to upskill. If you're thinking about high cost and lack of facilities that require minimal equipment and facilities, for example, high cost and lack of facilities. So select activities that require minimal equipment or facilities, for example, walking, jogging, or skipping. Identify inexpensive and convenient resources available in the community, or speak to your GP about referral programs. And finally, we have weather conditions. You can develop a set regular activities available regardless of the weather, such as indoor swimming, dancing, skipping, or at-home activities such as indoor cycling or exercise videos that can be done in the comfort of your own home. So physical activity and the COM-B model. Physical activity can benefit both physical and psychological health. The COM-B model, which is a behavior change model, can help us understand individual behavior being physically active each day and can be influenced by what we know and what we can do, so our capability, the people around us, and our physical environment, which is our opportunity, and our beliefs, what we want and how we see ourselves, and how we regulate our emotions and our habits, which is our motivation. What can we do to be more active? So find motivation to be more active. Do what makes you feel good. Do what's fun. Do what's sociable. It increases your confidence, your self-esteem. It prevents poor health. It saves money, and it's good for the environment as well. So what can we do to increase physical activities as individuals? We can make small changes, for example, taking the stairs, incorporating walking into the commute or the school run, taking lunch away from your work desk, taking a brisk walk or a jog during TV adverts, walking, running, or cycling alone with friends, family, or taking group classes, having a personal trainer, or sports that can be organized informally or formally with friends and family as well. So, workplace physical activity statistics. In 2021, 1 in 5 working adults, which is 20%, reported being very physically active at work. 23% of men are more likely to report this than 16% of women. Among both sexes, the proportion varied with age, with the highest levels among 16 to 24-year-olds and 55 to 64-year-olds as well. Physical activity in the workplace, why promote it? So promoting physical activity is part of promoting health in the workplace. Research has shown that benefits of improving health in the workplace include increased motivation of employees and a better work environment, leading to positive work outcomes, a reduction in absenteeism and staff turnover, increased quality of service, and more innovation and rise in productivity. Finally, increased public image of the company, making it a more attractive employer. So, what steps can be taken in the workplace? Employees could promote the following. When in the office, walk to colleagues' desks instead of emailing. Take the stairs instead of the lift. Park away from the workplace and get your steps in. Walking or cycling all the way or part way to and from work. Or partake in the bike to work scheme, Couch to 5K, or Active 10, or partake in park runs. And organising a lunchtime activity group, for example, walking, cycling, or swimming. So, physical activity pre and post pandemic. So, the Active Lives Adult Survey reported looking at physical activity levels pre pandemic and post pandemic. It stated that adults physically active levels in England bounced back to pre-pandemic levels. It stated that between November 2021 and November 2022, 63.1%, which is 29.1 million of the population, met the Chief Medical Officer's guidelines in doing 150 minutes or more of moderate intensity physical activity a week, an increase of 1.7% year on year. So here are opportunities to be more active within different environments within Birmingham, such as nearby parks, the Active Wellbeing Society, taking part in Bike to Work scheme, for example. So the advice is make use of the free activities of your local leisure centre, explore your local green spaces, learn and to ride and increase cycle confidence with Active Wellbeing Society, ditch the car for short journeys and save money on travel costs, and check if your work has the Bike to Work scheme as well. So there are support available within Birmingham, and these slides will be distributed out to you all. So there could be free activity opportunities for all Birmingham residents. And here are things like Park Run, Sport Birmingham, Connect Sport, and Be Active, the Active Wellbeing Society, as well as the Couch to 5K and the Active 10. There are resources available that will be distributed out to you all. So what can we do to help? This is where the Bolder Healthier champions come in. Your role as a Bolder Healthier champion is to talk about the importance of physical activity and encouraging people to take up physical activity. Share those important health messages by distributing the information you've learned within your communities. Connect people to the resources that can help them or someone they know, whether it's a website or through an organization, helpline or a helpline or an organization, sorry. And finally, feedback to us. Is that information useful? What kind of other information do you think would help? What else can we do to get the message across? Is there a particular topic you would like us to focus on? Let us know. Talking to your community. Talking should always be done with the intention of helping connect people to the right support, not taking the responsibility of offering professional guidance. Always use approved information to try and remain neutral. don't get personally involved with people if you're trying to help. Talking to your community, you can spot people who may need your support, share the message, and encourage people within communities to go and be more physically active, and promote the webinars within your network. Questions that you could ask include, do you know where to get information on physical activity? Do you know what the health benefits of working out are? And do you know how long you need to be exercising for? So this is an example of how you can offer help without getting personally involved. You can offer brief and immediate support to find out what help is needed, and then direct the person to the resources we have given you. So here we can use the ACT Advise Assist model, and we can use the example of someone trying to find information on physical activity. So you could ask things like, have you visited your GP to get clarity on physical activity across Birmingham? Do you have family and friends that you could be working out with? Or do you know how much physical activity you should be doing on a daily basis? Then you can advise by letting them know there are a lot of information on the NHS website, the government website, or the council website, and ensure that if they need further support and assistance, to speak to a healthcare provider as well. And then act by signposting to all of these different situations like Parkrun, Active Wellbeing Society as well. Here's a case study of Elle and Simon, who have both recently attended a physical activity webinar. Simon has recently started the company and is now in a new area and is having his weekly one-to-one conversation. He's asking Elle if she knows information on local activities, and she has signposted him to different websites such as Sport Birmingham Activity, Activity Finder, Park Runs, and Active Wellbeing Society. Sometimes you can help someone best by offering practical support, especially if they're struggling to find the time to research the information for themselves. Here is a directory of resources, and you can click at your own leisure as well. You are our eyes and our ears for the community. You call and tell us where more help is needed and how best to provide it. Email us or connect through our social media at any time. We hope that you're enjoying these sessions and are enjoying promoting the positive health and support to your community to improve health and well-being. We want to thank you for volunteering to be a Bolder Healthier champion. Your role as a Bolder Healthier champion is to share the information into your communities to encourage and support health and well-being of our champions. Our champions are advocates for health and well-being messages in Birmingham by distributing this information into a wide range of communities and networks. We support you through monthly themed webinars and tailored resource packs. We have previously covered physical activity and how it can be we've previously incorporated into our daily lives, as well as the benefits from increasing regular physical activity, even in small ways. We also covered cost of living crisis, diabetes, mental health, that type of thing as well. If you know someone who might be interested, and please encourage them to find out more by either searching Bolder Healthier Champions Birmingham City Council or by sharing the link with them when you receive the slide deck. And finally, thank you for joining us today. We could not do this without you. Thank you very much.